Hey guys, it's Dr. Samir Islam, and today I want to talk about some of the treatments we can offer for you for reflux to hopefully cure your reflux and get it taken care of. I want to focus today on this new procedure that we're doing called a transoral incisional fundoplication, or TIF procedure. We're really excited to offer this procedure for our patients to help cure their reflux and hopefully prevent our patients from having issues with their heartburn and regurgitation. So as a review, keep in mind, when we define reflux, we define this as the reflux of gastric contents causing troublesome symptoms. Typical symptoms: heartburn, regurgitation. If you have those two symptoms, you have heartburn, you have GERD, you have reflux. But some of the atypical symptoms include things like chest pain, hoarseness, cough, asthma, and this sensation of globus, or this feeling in the back of your throat where you have to keep on swallowing and swallowing and swallowing. But other associated symptoms for heartburn include things like indigestion, pain, bloating or belching, and nausea as well. The most common risk factors by far is obesity. Obesity causes worse symptoms of reflux and also causes worse complications that occur from GERD as well. But things like a hiatal hernia can make reflux symptoms worse, and some of the medications you may be on can help lower the sphincter to make it open more often, to cause symptoms of heartburn and reflux to occur. And of course, pregnancy. Pregnancy does make your reflux symptoms worse. Yes, history alone can diagnose symptoms as long as you have typical symptoms, but for some patients, we may have to undergo an upper endoscopy or an EGD, especially if they have warning signs. Things including symptoms over the age of 50, painful or difficulty swallowing, significant nausea or vomiting, weight loss, bleeding or being anemic, or getting full very quickly or easier as well. So the initial treatment that we offer for patients are lifestyle things that you can do, so things that are to avoid symptoms of reflux include things like avoiding alcohol, high fatty foods, tight clothing, increased waist size, or being overweight or obese. So by minimizing these items or losing weight, you're able to hopefully control your reflux symptoms. But if that doesn't work, there are options for medications, including things like antacids, which work very effectively for people who have reflux. The only problem is that they only work for intermittent heartburn symptoms. You can go up in class with the H2 antagonists, which include things like Tagamet, Pepcid, Zantac, or Axid, which are very effective for heartburn, but they're not the most effective medical treatment, which includes the things like the PPIs or the proton pump inhibitors, Prilosec, Zegrid, Prevacid, Nexium, Dexilant, Protonix, and Acifex. These are the best medical options for heartburn and reflux, and they're very effective to help out with your reflux symptoms. But having said that though, I have a lot of patients who come to me who don't want to be on medications anymore, who are worried about some of the side effects that you may have heard about these medications, and you want to try something different, or you want to potentially get off of your acid reflux medications or not suffer from any more heartburn or reflux. And this is where this other option is, which is the surgical options for your heartburn or reflux. And there are two main surgical options that are out there. One is the traditional Nissen fundoplication. This is a surgical procedure where you're basically wrapping the esophagus or the stomach around the esophagus from the outside to create a tighter sphincter. And this tighter sphincter will prevent that acid from coming up into the esophagus, causing heartburn and regurgitation. Now, it's a very safe and a very effective procedure in the right patient. It's 90% effective, so it's really, really good, and it's been around for a long time. However, the Nissen procedure does have its own side effects. Number one, some people have gas and really bad bloating with this. And this is a very common problem a lot of patients have after they have a Nissen. They have a lot of bloating, a lot of gas, they don't feel well. The Nissen also prevents you from vomiting, and so you cannot vomit with the Nissen. And so you have this tight sphincter that's made around the esophagus because of the stomach that wraps around it. And because of that tight sphincter, nothing can go up, and so you can't vomit. So even though you may feel the urge to vomit, you physically can't when you have the Nissen fundoplication. For some people, they may have difficulty swallowing, or food may get stuck at the area where they did the surgery. For some people, they can develop what's called a dumping syndrome, which is really bad diarrhea, typically after a surgical procedure. And for some people, the Nissen doesn't work. There is a risk of the Nissen becoming undone to cause reflux symptoms to occur. And so for some people, this happens, and this can be a side effect from this procedure. So because of these issues, this is where the TIF procedure came into play. This is a permanent solution that we can offer for heartburn, reflux, or regurgitation. The benefit about the TIF is that it's completely incisionless. There are no scars. I'm not cutting you up. There's nothing that I'm having to open up to help fix your heartburn and reflux. And that's the benefit about doing this TIF procedure. Now the reason, and this is why it's very effective, we actually work from the inside of the esophagus as opposed to the outside of the stomach. We actually work on the inside. So we go down with a very small camera. We take a look down, and when I take a look down, I look on the inside of the stomach, and I can see if I can form that same wrap on the inside of the stomach. So it's non-surgical. We're doing it all from the inside. There's no scars that need to be done or need to be had. Now this is a very effective procedure in the right patient. And the right patient includes those who don't want any more reflux, who want to stop their medications, who want to be on a normal diet and not have to avoid all the things you have to avoid to help minimize your heartburn symptoms. And for those patients who may be worried about the long-term side effects of being on things like Nexium or Prilosec. It's a very effective option for these patients who don't want to have that done. Now there are inherent risks associated with the TIF procedure itself. They're pretty small. They're about 10% as a whole, but for most patients they do really, really well with this. But the main symptom is pain. Some people are going to have some pain after the procedure because we're manipulating the area around the lower esophageal sphincter where the valve opens up. There are some symptoms of nausea as well, which typically will go away. There are some patients who have some bleeding. It's not typical for that to be the case. But there are some patients where it may not actually work, and so we do a thorough workup. We understand that the problem is the valve, and people will have really bad heartburn or reflux. But when we do the procedure, it may not work for them, and that is a complication that can occur in some patients who undergo the TIF. We just can't take care of the reflux. But I would say, in my experience, in the right patient, this is a very effective non-surgical treatment to help take care of your heartburn or reflux. So if you're trying to decide between a surgical procedure like the Nissen or a non-surgical procedure like the TIF procedure, I think they're both very effective. They both work really, really well. The Nissen's been around for a long time. It's a very effective procedure in the right patient. The main side effects from the Nissen include, it's a surgery, and so there are inherent risks with performing a surgery. For some people, you can get a lot of gas, a lot of bloating as well, which can make things very difficult to handle. And also with the Nissen, you cannot vomit, and that can be a serious side effect, or at least a troublesome side effect, especially if you feel the need to vomit. With the TIF procedure, it's non-surgical, so I'm not cutting you open. You don't have the symptoms of the gas or bloat, and you still can vomit with the TIF procedure. You don't have any problems with that. If you need to vomit, you can still do that. So in the right patient, the TIF procedure is a very effective option. It's a very new procedure they're offering for patients who have chronic acid reflux who want to get off their acid medications. So in summary, like I mentioned before, the Nissen is very effective, but there are gas bloat issues, and you cannot vomit with the Nissen. The TIF procedure is also a very effective procedure, and it's a very good alternative for the Nissen if that's an option that you want to do. And it's a procedure that I currently do for patients who have chronic acid reflux or chronic heartburn. It's very effective and works really, really well. I want to thank you guys for watching this video. If you like these YouTube videos, I encourage you to like my YouTube page, give me a thumbs up, and I would encourage you to subscribe to my page as well. Thanks and take care.